Mr. President, in a few days, the Senate will be voting on final passage of an historic health reform bill that will ensure an additional 31 million Americans who have no health insurance at all. And that is a huge, huge accomplishment. About half of the new people to get health insurance will be enrolled in an expanded Medicaid program. While this reduction in the number of uninsured is an essential step in achieving reform, we have got to ask a very simple question. If 15 million more people go into Medicaid, where are they going to access the health care that they need? It is no secret that today Medicare is a strained program. When some of my Republican friends make that point, I have to say they're right. It is a strained program. And that is why expanding community health centers and the National Health Service Corps is so important. You know, Mr. President, we talk about the number of people uninsured. Very important number, 46 million. But we don't talk about the number of people who every day do not have access to a physician or a dentist on a regular basis. And that number is close to 60 million. These are people, when they get sick, can't find a doctor. Where do they go? Well, several things happen. They may end up going to the emergency room, which is the most expensive form of primary health care that we have. That's where they go. Or even worse, they don't go to any doctor at all. And what happens is they get sicker and sicker, then they go stumbling into a doctor's office, and the doctor says, "Why didn't you come in here 6 months ago?" And the person, "I didn't have any health insurance, couldn't afford it." And they go to the hospital, and we spend tens and tens of thousands of dollars treating somebody who is now suffering in a way they should not have suffered at greater expense to the system than should have been the case. Now, what sense does that make? And let me tell you the worst case scenario. The worst case scenario is they walk into the doctor's office and the doctor says, "It's too late. Can't help you anymore. You should have been in here 6 months ago." I have talked to physicians who have told me about that. I suspect you have as well. And that is why this year we're going to see 45,000 of our fellow Americans die because they don't have health insurance and they don't get to the doctor when they should. Now, one of the advantages of the community health care program is that it is an enormously cost-effective program. One study recently reported that $20 billion is wasted every year in this country in unnecessary and inappropriate use of hospital emergency rooms for non-emergency care. Now, when you walk into an emergency room, I don't know about West Virginia, but in Vermont, it's about $600. If you get that similar care for a non-emergency type ailment, the cost is $100. So think about all of the money that we save when we have community health centers expanding all over the country. Now, one of the issues that we have not focused on enough, in my view, in this whole health care debate is the very serious crisis in primary health care in general. The American College of Physicians, in a recent report, warned that the nation's primary care workforce, which it called, quote, "the backbone of our health care system," is, in its own words, on the verge of collapse. That is the American College of Physicians. Over the past 8 years, for example, the number of family practice residents fell 22%, while the overall number of medical residents rose 10%. Currently, and this is an extraordinarily frightening statistic, only 2% of medical students interested in internal medicine intend to pursue primary care as their specialty, 2%. This growing crisis was recently underscored in a report by the Association of Academic Health Centers, which warned that the country is rapidly running, quote, "out of time to address what is out of order in our health workforce," end of quote. Now, the good news is that 20 million of those people who live in medically underserved areas are fortunate to live where there are federally qualified community health centers. And let me explain a bit. What is a federally qualified health center, which exists in all of our states, 50 states? It is a center which says that if you have no health insurance, you can walk in. And you know what? You will pay not only for primary health care, but for dental care, which is a huge problem all over this country. For mental health counseling, you'll get the lowest cost prescription drugs available in America, and if you don't have any health insurance, you get it on a sliding scale basis. If you got Medicaid, you are welcome into the center. If you got Medicare, you're welcome. If you have private health insurance, you are welcome into these centers. Currently, these centers serve 20 million Americans in all of our 50 states. Conceived in 1965 as a bold new experiment in the delivery of preventative and primary health care services to our nation's most vulnerable people and communities, community health centers are an enduring model of primary care for the country and are designed to empower communities to create locally tailored solutions that improve access to care and the health of those they serve. West Virginia centers will be different than Vermont centers, will be different than California centers, because they are designed and locally controlled to serve the needs of the local population. By mission and mandate, community health centers must see all those who seek their care, regardless of health status, income level, or insurance status. If you're rich, if you're poor, you will gain access to these community centers. Nobody is tossed away. Today, these health centers are America's health care home to 1 out of every 4 low-income uninsured individuals, 1 out of every 6 rural Americans, as well as 1 out of every 7 Medicaid beneficiaries and 1 in 4 low-income people of color. We need to guarantee that as we expand coverage, we expand community health centers as well,